problem with the young age group is because so many of them get it but don't get sick, they walk around with it. They may have mild symptoms or no symptoms, and that's a problem because then they can infect everybody else. The entire country needs to be concerned and needs to continue to hold the line on social distancing, wearing masks, all the cautions that we have said from almost the very beginning are important. We need to especially now double down on that and not let up on any of that because despite what we thought was working initially, everybody relaxing a little bit, we're seeing these cases spike, and so it's hard not to draw the conclusion that what we were doing in terms of the masking, social distancing, and all that was effective, and as soon as we relax that, we can expect to see these spikes. We are testing more individuals, but when you look at the percentage of positives that are going up, that percentage is still a positive trend line. So this is not just we're testing more people, so more are positive. The actual percentage of people getting infected is continuing to rise. Any large groups, there's a potential that there's somebody in that group that may be infected and may be contagious and not know about it. So I think anywhere where people are gathering in large groups and or not social distancing, not wearing the mask, they can assume that they're putting themselves in harm's way. You're always going to have some controversy about the masks. I think that the preponderance of evidence right now and from the beginning has supported wearing masks. And again, masks are a slight inconvenience for people. There's close to zero data that masks have any adverse effect on our health. So I think it's a slight inconvenience for a potential huge savings in terms of safety. So I just cannot imagine or justify people not wearing masks at this point. I think the reason we wear masks in public is so they do protect us, and depending on the kind of mask you're wearing, even the cloth mask, which is the least protective mask in public, will protect the people around you. The most common ways that this virus is transmitted is through droplets. And so, you know, if you're within 6 feet of somebody, just talking, but certainly coughing, sneezing, laughing, and all that, that all generates droplets. And so you need to have a barrier. And the mask is what provides the barrier from the droplets from getting from point A to point B. This is still a tremendous learning curve. I think we're still more toward the beginning than toward the end of the learning curve. And so things are evolving all the time. And so we're always racing to try and keep up with what is the best evidence. But it's still, a lot of the times, it's a collective hunch. So we go with what do our experts think is the best information at the time, and that's what we need to formulate our policies based on. Say that if you are completely asymptomatic and don't need to know for sure because of a potential exposure, work-related and things like that, people hold off on testing. I would not at this point say we should just test everybody just because we don't know what to do with that data, for one thing. It's important to get the kids back into school, but I think the strong strategy behind that has got to be we need to do what's safe. There definitely is some evidence that kids are less contagious, that kids are less susceptible, but that's not zero. And so if we just open the schools, let everybody come back in and don't take the appropriate precautions, that is going to pour some fuel on the fire. Sports, especially contact sports, that's a particularly tough challenge, figuring out how to do that safely. Because again, one of the basic strategies is the distancing, you know, and if you're going to be up that close, you have masks, but then you have sweat transmission, skin-to-skin transmission, and all those other issues to contend with. So I just don't know how you do that safely.
Is that the challenge?
Administrator, so I understand about business and how people need to have their lives and their businesses, and the economy needs to move forward. But I'm also a physician by training, and so the physician part of me says, we got to balance that with how do we be careful, you know, and I'm always leaning more toward the side of how are we careful, because I've seen up close the devastating effects of this thing, you know, when we're not careful and it gets out of control. And
how difficult and how dangerous is this disease truly, this virus, excuse me, is it truly when you're seeing these patients, you're seeing how much damage it can do to somebody?
Yeah, I mean, people are dying. It doesn't get much worse than that. So the younger age group is more resilient. They probably get infected at the same rate all the way down to pediatrics. Pediatrics are a little bit less susceptible to infection. The problem with the young age group is because so many of them get it but don't get sick, they walk around with it. They may have mild symptoms or no symptoms, And that's a problem because then they can infect everybody else.